think that the focus from an RBC perspective was to do two things. One is to remain open and knowledgeable about the debate that was going on throughout the country with regard to health care, and locally to focus on the cost side of the equation, which was through being a proponent of wellness.
This bill is called the Patient Protection and Affordable Care Act. It is well over 2,000 pages long. It is extremely complicated. Our government relations team has told me that within the bill, it says the Secretary shall 1,045 times. What that means is that the Secretary of Health and Human Services has an awful lot of regulation and rule writing to do.
What we have is a coverage bill. And whether it turns into a cost control bill is another question. So in the short term, we're getting a lot of people covered, but we really haven't done the things that would control costs.
Healthcare is threatening to consume much more of the economy than what it should otherwise do, and inflation is running about 3 times the national average in healthcare. Clearly that's not sustainable. It's not sustainable from a cost perspective, and it also is making us uncompetitive on a world market with all the products that are produced here in the United States.
There was some concern at the very end of the negotiations because at the 11th hour some of the craft unions worked to slip in this provision for certain employers that had to provide health care coverage. The construction industry was actually called out singularly in the bill by some of the building trades, and that amendment ended up getting in the bill. Why construction should be treated differently than any other industry is still a mystery to me.
Certain provisions of the bill kick in right away. Things like the elimination of lifetime maximum limits for healthcare coverage, elimination of the risk that you might be denied healthcare coverage once you get sick. Those kinds of things happen right away. Other things happen over a period of time. The increase in Medicare tax that many people will feel doesn't really kick in until 2014.
There's going to be profound impacts on the business community from this bill. First and foremost, if you just look at the additional taxes that are going to be levied on the pharmaceutical, medical device, and insurance industries, that's going to generate about $110 billion in taxes over 10 years. You can expect that those costs are going to be passed through to employers in the form of insurance premium costs.
None of the regulations have really been established, so first and foremost we got a bill. We don't have the regulations established, so we're not totally sure. And I guess I would just take a step back and say what I said earlier is that our concern ultimately will be that costs are going to, when you get regulation, normally you get higher costs, and that will occur.
In the short term, we think there's going to be a further exacerbation of the cost problem as more people try to get into the system and there isn't that capacity.
When you look at the Medicare tax that's getting deployed, as well as the so-called Cadillac tax, that generates about another $240 billion in cost over the next 10 years. That's going to certainly have implications for employers as they look at attracting and retaining talent.
In the area of prevention, any new employer-sponsored plan that renews after September 23rd of 2010 must include 100% coverage for all preventative care. No coinsurance, no deductibles, no restrictions whatsoever, 100%.
Some of the plans are going to need to change the coverages because I think in 2010 you have to cover folks up to 26 years old. That's one thing that a lot of the plans are going to need to put in place, which is going to be somewhat of an increase in what the health and welfare benefits are going to have to be for the unions. So that'll increase the health and welfare costs, which may have the implication of making them less competitive in the market.
We think employers in general are going to be looking at the cost benefit of paying the fine and having their employees go to these exchanges instead of providing healthcare coverages within their companies. So I just think there could be a real shift in how our country delivers healthcare insurance.
Depending on how well the state exchanges work will depend on how well this plays out for the small employers. Those employers that can manage their own benefit through the use of consultants like the big companies, they should be just fine.
I think most of us in healthcare industry would say we should have done the reform bill, we should have done some things to get the delivery system fixed better than it is today before we added all the volumes of new patients.
Employers will, I would assume, have to hire many more people to keep up with the issues. An issue like the new requirement for any transaction of $600 or more, that you'll have to complete a 990. Every employer who does any transaction, whether it's on the receiving end or the giving end, would need to complete that kind of paperwork.
You can't buy auto insurance after you've wrecked your car. You can't buy homeowner's insurance after your house is burned down. So we want everyone in the system participating all the time. So that's the first thing that I would really talk about as a concern. The second is affordability. And the bill probably didn't do enough to deal with this, to deal with some of the drivers. Overutilization, increases in unit cost. So that's something as an industry we really have to get our arms around, and it's a concern of mine, but I think this bill was not the end of it. This is one step on the path.
Regarding wellness, there's a provision in the law whereby a healthy employee, somebody that decreases their blood pressure, monitors their cholesterol, as an employer, you can offer them an incentive of saving 30% of their premium versus only 20% today.
Another positive aspect of the bill is it provides funding for what's called demonstration projects. And those demonstration projects are designed to find better ways of delivering healthcare, different healthcare models, different payment schemes. But it allows us to try them out in a pilot type of a fashion to see, frankly, what works, and then whether or not that's appropriate to roll out to the rest of the healthcare community.
The little steps that were somewhat good were some pilots around payment reform. Getting to accountable care organizations, the bundled payments, really the things that we wanted managed care to do a decade ago or more are coming back.
There's also some things in there that I like that could help us align our incentives even better and more effectively with physicians and hospitals. So there could be more performance-based contracting, more alignment of incentives with different entities in the industry. And I think that's a good thing.
As a country, we really need all parts of this system to be healthy. We need the insurance carriers to be healthy. We need the providers to be healthy. So we really need to pull the system together so that we have a sustainable model for the future.
A huge element was missed in the whole healthcare debate, and that really is the tort reform. And this thing that we believe creates defensive medicine that is being practiced, which is going to continue to accelerate from a cost side.
There are new definitions of full-time employee and full-time equivalent. The Department of Labor is another one to watch because they're in this game too, identifying those new definitions basically.
For your employees, there's going to be a lot of concern about what this means, and so clarity and communication, I think, is going to be very important. And one of the things that we're focused on as a company is, as we gain better understanding of the rules and regulations, how do we effectively communicate that to our employer groups as well as our members? I think that's going to be key.
Everything will be a family plan, and the impact of that will help soften the cushion on the Cadillac excise tax provision that's supposed to kick in 2014. So there's time to ramp in some of the changes. However, there's still some concerns that what is grandfathered and what isn't. It's unclear as far as how that's going to impact the multi-employer plans.
It is really about staying connected to make sure the regulations work over the long haul, because it's really about regulations and execution that's going to predict how this plays out over the next decade.
I think the real question is what's going to happen in November. If there is a big backlash and there's a lot of Republicans elected, will that ultimately undo this or mitigate it in some way?
This thing is going to be very, very costly. And the cost to provide that health care to an employee is going to go way up. And so something's got to give. You either provide more health care, less wages, or more wages, less health care, but something's got to give.